I'm Dan Drake. This is Front Up on Geno TV and Channel 99. Our guest is Holly McGowen, who is responsible for the Alliance for Substance Abuse Prevention.
I'm the current president, but I'm not responsible. It has a long history, actually.
Well, no, but you're responsible for running it is what I meant.
Yes,
yeah.
yes.
And delighted to have you here. Just talk a little bit about the organization, how long it's been around, and what its mission is.
I believe it was established as far back as maybe 1985,
Mm-hmm.
And the mission is to, reduce and prevent substance abuse and alcoholism for youth and
Mm-hmm.
community, and encourage access to treatment, education.
Mm-hmm. You do it a variety of different ways. We'll talk about first your event that you're having, this Red Ribbon Week,
Yes.
which is coming up.
Yes, that's a big national campaign, actually. And it's celebrated in many states and school districts. And it's supposed to be a way to engage the community and students in awareness to the issues of alcohol and substance abuse. And we run a multiple of events throughout that entire week. It starts at the end of October, the 24th this year through the 30th. And you should be made aware of it as we get closer to the date.
Is this something that primarily for parents, or is it primarily for students, or some of both, or
It's
even
really
for,
both.
And other people too?
It's for everybody. We have programs in the schools during that week. For community, we make people aware by having the Yell group, which is a Youth Empowering Lasting Leadership group that ASAP started, and now the community school runs that, but it's a middle school students body, and they'll put red ribbons up around public buildings in the town and in front of the schools for us. Then in the schools, we try to do a lot with the middle school population in particular, because we feel that's an important student body to start with, or not start, but promote awareness and education for substance abuse prevention.
And particularly impressionable group.
Yes,
Either way.
yes. I feel strongly that it is. So every year we have a big pledge board that the students sign, 6th through 8th graders. They sign the pledge board to be drug-free. This year's theme is You Only Live Once, be drug-free.
Do they all sign it?
As far as I know, there are a lot of names on it, and then they put it up in the cafeteria, and it stays up there in the cafeteria as a reminder. We have a poster contest, so the different homerooms create artwork, and the winning advisory gets a pizza party at the end of the week. This year, we're thinking that we might make a T-shirt out of the artwork, the student artwork, and it also gets posted on our Facebook page as the Facebook page home piece of work that goes on throughout the whole year until the next one.
You also bring specialists in. We interviewed Janina Keene, is it?
Yes.
Early in the summer, and she was
Correct.
talking about some of the work that she's been doing, and I guess that's continuing. She's going to be around at least through the end of the year, is that right?
Through the end of December, at least, yes. And her work, she started with ASAP, and the Behavioral Health Task Force has picked up to contract with her to continue her workshops, Family Awareness Program on Addiction. They're 2-day workshops, so we have one coming up at the end of this month on Friday and Saturday again. And this workshop will have also a mental illness component to it. So she will speak to co-occurring disorders with addiction as well in that workshop. But it's been very effective. People have responded very positively to the information. It's a really good workshop if you have a loved one who is suffering from substance abuse disorder, or if you are in recovery. It's really good for anyone impacted by addiction.
Is the approach to drug abuse and the approach to alcohol abuse the same, or do the paths diverge somewhat along the way?
They're both brain disorders, so they're treated relatively the same, but I'm not a clinician, so it's not really safe for me to answer that.
Okay, fair enough. Fair enough. What else? How else does ASAP operate? I mean, what other things do you do besides bring in people?
So we do bring in presenters. So this year's presenter, his name is Rick Cresta.
Mm-hmm.
He'll be speaking to the middle school about marijuana, and also to the community in an evening presentation. And he has a Master's of Social Work. He is part-time faculty for BU in social work. He also works with adolescents and at-risk youth in the justice system. And he has given presentations across the country on this issue of marijuana. So I think he'll be discussing, what's it all about? What are the facts? What are the myths?
I assume you have a position, formally or informally, on the initiative on the ballot this November about legalizing marijuana.
I'm not going to state my position.
I mean, does ASAP have a position?
No. Everybody's an individual that's on the board. So I think the most important thing is to study the issue and be educated about marijuana, and then make your decision.
It's interesting because I had somebody who worked for me a number of years ago for quite a few years, 10 years, maybe 8 or 10 years. Turned out he'd been smoking one joint a day for about 15 years, since he was like 20. And all of a sudden he had what is called, I guess, by a clinician, a psychotic break, when he just went off the deep end, and it was attributed to that marijuana usage.
Yeah, that can happen. This science is showing that there definitely can be a link between psychotic breaks and long-term use of marijuana. For a young brain and adolescence, a young brain that's just forming, it can affect the prefrontal cortex quite a bit, and that's why any substances should definitely not be used
be avoided,
at an early age. Yeah.
How is ASAP supported?
So how is it supported?
Yeah.
Oh, well, we have a grant from the town that helps us promote Red Ribbon Week and all the activities. And then we also have a Drug-Free Communities grant, and that's a federal grant that we were awarded 5 years ago, and that was renewed for another 5 years. So we're on year 8 of that grant, and that allows us to put prevention strategies in place for schools and community. What we've done recently is we've had a survey in the community 2 years ago, and a survey in the schools called the Pride Survey. So students grades 6 through 12 were surveyed, and then the grant consultant returned to also conduct key leader and focus group studies. So he compiled all the information that he gathered and some archived information. And as a community, we had people invited in to assess and prioritize the risk factors for substance abuse in the community.
Are
So
different communities different in those respects, or the risk factors
I
pretty much?
guess they could be slightly different,
Yeah,
yes.
interesting.
Yeah, in terms of priorities.
Do you have, does ASAP have full-time staff, or?
We have one paid employee, and that's through the Drug-Free Communities grant. And that is the program coordinator. And that person attends the coalitions on alcohol and drug abuse prevention. Coalitions of America is an acronym, CADCA, which I can't remember completely what it means, sorry. But every year they have a big convention, and there are lots of best practices in terms of prevention that are presented at this convention. And so that coordinator brings them back to the board, and then we discuss what strategies we'd like to use.
Anything else we need to know?
Well, I hope everyone gets involved with Red Ribbon Week and the campaign in some way, and attends the presentations. There's also a presentation that the Friends of Nantucket Public Schools sponsors for the community. That's at Boston Improv, Improv Boston. And they also, Improv Boston, will be presenting to the elementary school students and the middle school students for an anti-bullying presentation. And then there's a family evening during that week as well.
With Boston Improv?
Yes.
Yeah, that's great.
Yes.
That's great.
So
Well, best of luck with it, and thank you for coming on and talking about it.
thank you.
Holly
Thanks for
McGowen,
having me.
Thank you so much.